We are back on MorningLine. Thanks for joining us on this Thursday. Kind of flip-flopped, did open phones. Well, we were going to go open phones yesterday until we had some technical problems. But today we're doing the topic, as you see on the screen, effects of the proposed health care bill being discussed in the Senate right now. Postponing a vote. Support not really there, but the senators forging ahead. This was a promise from President Donald Trump. Linda O'Neill's with us, with the executive director of the Tennessee Commission on Children and Youth, and Kinika Young as well with us this morning from the Tennessee Justice Center. Kinika, as we went to the break, before we get to the phone calls, I was asking, just beyond the cuts in Medicaid, what other things are you concerned about and what they're considering right now?
Well, we're concerned about the bill allowing states to opt for a waiver, which would allow them to sell plans in their state that don't have essential health benefits, as that has been defined by the Affordable Care Act. So states would be left to decide for themselves what is an essential health benefit. So things like hospitalization, prescription drugs, rehabilitative services, etc., those things may not be offered in the plans that insurance companies are allowed to sell on the marketplace.
But as a customer, I would go to the marketplace and I'd see, well, you're not including that. This is a worthless plan, which is exactly what it would be. And I'd say, I'm not buying you. I'm going to go buy one that does. Now, if I have a pre-existing condition, would I be able to buy anyone I want? Because that's one of the things that, they say they're going to keep. If you have a pre-existing health condition, you'll still have access to health care.
The question would be, can you afford the plan that you need when you have a pre-existing
condition? So the cheap ones will be the ones that are worthless.
Exactly.
Okay, that don't offer the essential things that you would expect. I mean, I'm just thinking you have insurance at home, right? So what do you expect from your insurance plan? I mean, I expect help in covering hospitalization. I expect, my doctor's visits, physicals maybe to be covered. What were some of the essentials you said too?
Prescription drugs. Emergency care.
So there may be some that a state would allow to be offered that don't include those things?
There would, potentially. States would be, they would have the option to decide what they think are essential health benefits.
Okay, and if they exclude the essential health benefits, what would they offer?
Well, the plans could cover a combination of different categories, such as outpatient care or well visits, that sort of thing. Emergency care could potentially be included because hospitals would, have a fit if the insurers are selling plans that would potentially keep them from being paid for providing emergency services. So there are certain categories of things that would be included, but the Congressional Budget Office, which is the bipartisan group that scores the Senate's bill, they've said that most people would be incentivized to buy a bronze level plan. That's what's on the marketplace today. The bronze plan has a $6,000 deductible. So when they talk about lowering premiums, they're only addressing a part of the financial puzzle because you still have other out-of-pocket costs that are out of reach for most people. If you're making $12,000 a year, which is the federal poverty line, then $6,000 in a deductible is pretty much no coverage.
Yeah. I mean, the more you hear about, the more you understand why support's hovering at around 12%. And a lot of these Republican senators who, want to pass something to improve it are balking at it. Because I'll tell you, they pass this and their constituents get hammered, it's going to hurt them politically. That's the thing. We all know that's what it's about. Senators are more concerned about keeping their seat. Let's go to Brian. Brian, good morning.
Good morning. I'm first.
Yes, you are, Brian. Go ahead, my friend. What's your take or question?
I got a couple things. I might not completely agree with the gentle lady from the government agency. I think that our small little clinics in the rural areas are doing better, and it used to be with less. Now it's with more, because you're getting more, and people realize. Now, I have the therapy clinic, which is an excellent clinic. It's a little town. A lot of little towns. I had friends in Kingsport. I was there when I was younger. And it used to be a lot worse back then, let me tell you. I mean, these people, it was really bad in the 80s and 90s. But for some reason, I don't know if it was Obamacare, because you know me, I'm a global Republican, but if something's working, I've noticed that the little clinics way out in the little towns, and they have a little van come by, a lot of these people, though, it's their lifestyle. They shouldn't be getting really overweight, eating sugar and stuff. So, you got that, too. But I believe, a couple basic rights in Tennessee. I'm really big, I'm a Sierra Club member, a big, fan of the nature and the individual rights, and, like the rural guys, they like that. And then, of course, I would think basic health care.
Yeah.
So, my brother's a doctor. I can most of my care for him. He's an eye surgeon, and then I have the clinic out here. And I can go to 30 clinic and get, I don't don't like blood work. I don't like doing a lot of that stuff. My woman makes me go. And I pay like $120, and then I went again, the total was only like $200, where if I went to another doctor, probably would have about $600-700. And they let me take like 3-6 months to pay.
Well, how do you feel then right now about what the GOP is considering?
I don't know. All I got to say is, if you're out in the country and you've got a little doctor, a little clinic, I don't even see a real doctor. It's like a nurse or practitioner or something, but he's pretty good.
Okay, so he seems to think some of the rural areas, at least in his experience, are still doing okay or better than they were years ago.
Well, I think what he talked about were the small rural clinics, and those have benefited from the fact that more Tennesseans have had insurance coverage since Obamacare. We still have a significant gap here. There's still 66,000 children in Tennessee who do not have any health insurance coverage, even with Obamacare. But it's the hospitals, not the clinics, that have suffered the most. And
why is that again? Because they're not getting the payments.
Because their costs are higher, and there's not, and people don't have the coverage they need. There's a recognition that if Tennessee had figured out a way to tap into the Medicaid expansion dollars, that we would have saved some of those rural hospitals, because people would have been able to come and pay. And rural hospitals are major employers in the community. Their loss affects jobs, it affects the school systems, it affects the vibrancy of the community as a whole. I think we all support those small clinics and know that they're really a critical linchpin in the healthcare system. We don't want anybody to go to a hospital unless they have to, and the more they can get preventive care, the more we can improve lifestyles, the better. But that's not a substitute in an emergency and life-threatening circumstances for a hospital.
If I could mention one other reason that hospitals are in a different bucket than clinics, is that there's a federal law that requires hospitals to screen and stabilize anyone that shows up to their emergency department. So you have people who don't have regular doctor's visits, who don't have insurance. They wait until something gets really bad and they're about to die, and they go to the hospital, and the hospital has to treat them. And so if that person doesn't have insurance and they can't pay their bill, the hospital has a huge debt. And they have to deal with this debt the best that they can, but it really weighs down on their books when they have such high uncompensated care that they are obligated to provide.
And that law likely is not going to change. And that's the whole story, and we've heard it. What you're explaining there is that basically that folks without any insurance and they get sick, they go to the most expensive place to get treatment, which is the emergency room. And then who pays for it? We all know who pays for it. All of us do, to compensate, which, and I understand not turning someone away. If some of these things happen and all these folks fall off because of Medicaid cuts and the like, I just imagine emergency rooms are going to see a spike, right?
They will, and they probably won't be able to handle it. We had a public hearing a couple of nights ago where a emergency room doctor at Vanderbilt talked about the number of people who are coming in their doors that they're struggling to keep up with, especially with the opioid epidemic that's really hitting
Which, by the
Tennessee
way,
hard.
They're talking about cutting a bunch of money for fighting opioid epidemic. When's the last time you've been in the emergency room at Vanderbilt? It's been a few years for me on a news story, not because I was hurt. That place is packed. Packed. They are so busy. It's amazing how many people go to the emergency, and many of them legit, but some going there because they have no other choice.
No other choice.
Let's go to Joe. Joe, good morning.
Good morning, Nick.
Hi, Joe.
It's a tragedy for the great country of the United States of America to have our health care in such a mess that it's in. Between Haslam and Trump, nobody really don't know, I don't think, what it even is in his proposals.
I don't think he necessarily knows the details himself at this point, the president. He speaks in broad-based terms and is letting the Senate come up with it, Joe.
Well, all I'll say, and I'll get off here, is if people are looking at this, even the Republicans are seeing that, people, Trump's looking through rose-colored glasses at this mess that we're in. But he hadn't really changed Obamacare. All he's done is mess it up. What little coverage these people had. If you're fortunate enough to have a decent insurance through an employer or what else, you're lucky. But to have a $6,000 deductible You're exactly right about the emergency rooms being full. You can go into the major hospitals in Nashville, and the emergency rooms are full for people that don't have insurance, and that's the only place they got to go.
Yeah.
So,
all right.
I'll say it's one big mess.
Yeah. I gotcha. It is. It is. High deductibles are there for private insurance costs. I don't know what you guys pay for your. You have a choice. You can go with the higher premium, lower deductible, or the lower premium if you're healthy, and the higher deductible, which is kind of what I'm doing, you know. But it's expensive for everyone. The big picture on this, folks, as we go to the break, is we can talk about all these things that they're trying to fix. What we really need to do is just find a way to bring down the cost of health care. I mean, pharmaceuticals and I mean, it's crazy, especially when you compare to the costs that they pay sometimes in other countries. We'll take a break and be back with more of your phone calls right after this. Yeah, I just came back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Hi, everyone. I'm Storm 5 meteorologist Leland Statham. Here's a check of radar. With an increase in moisture levels out there, we'll see a few showers and storms fired up over the Mid-South. Here we go with where we stand as far as our temperatures are concerned for today. Here are the numbers now from around the Mid-South and around the Southeast. Here are the numbers now from Nashville International. Your Thursday forecast calling for a high of 87 today. The normal high today is 89. We'll go with about a 30% shower and storm chance this afternoon. Chances for rain die down tonight, 20% rain chance tonight. But then notice the next couple of days with a higher rain chance coming our way on Saturday. We'll hold on to at least some small rain chances for next week with a high of around 90 on Monday and around 91 on Tuesday, the 4th of July. Thank you for watching News Channel 5 Plus.
How would you describe The Big Bang Theory?
A mind-boosting caffeine suppository.
How about it's TV's #1 comedy?
Fantastic.
The Big Bang Theory, CBS tonight.
When we say temptation, you say
Big Brother! Big Brother is back.
And this summer, it's Destination Temptation.
Oh, yeah.
For every temptation accepted,
let's do it.
Someone else is gonna pay.
Houston, we got a problem.
Julie Chen hosts.
Give in to your temptations.
A new Big Brother, CBS Tonight.
Tonight at 10, News Channel 5's Phil Williams has uncovered a threat to your children. A danger that families were never told about.
I was pretty appalled.
Why did officials keep this danger a secret?
We know that it can cause loss of IQ points.
Putting the health of even more children at risk.
And we also know that it can cause an increase in violence.
News Channel 5 investigates what's being done now to keep your families safe. Tonight at 10.
Back on MorningLine, thanks for joining us this morning, talking about what the proposed health care plan from the Republican-led Senate will bring as they put off the vote at least until after the 4th of July. But we have some basics here and how it'll affect us here in Tennessee. You know, with the Tennessee Commission on Children and Youth, we have Linda O'Neill with us this morning. Kinika Young is with the Tennessee Justice Center, taking your questions and comments. Let's go to Al. Al, good morning. Hello, Al. Hi, Al. What's on your mind?
I wanted to talk. I'm a retired physician, originally from Tennessee and then back to Tennessee again. Last year I broke my leg. I'm in Hermitage. I was able to go to Tri-Summit and get first-class health care. I heard you talk about Vanderbilt, and I know how that is, and that would have been my other option, even as a retired physician. I'm now on Medicare, but I also wanted to mention my daughter, who 6 days ago delivered a Down syndrome baby. She decided to keep it. It's a high-level situation, but she got excellent prenatal care, and I'm an obstetrician. She got the superb care that she should have had, just like anyone else would have gotten. And she delivered 6 days ago a 4-pound, 9-ounce baby that's doing well. And it would not have done well. That doctor watched like a hawk. So I just think that we have to look at compassion here, look at all all the people. We can't have some people where they have the same accident. I broke my leg on my jet ski racing. I did not have to pay the penalty to go to Vanderbilt and wait all day and I was getting regular care. I got good rehab care. All that was taken care of. I hadn't been on any type of plan like this, but I was so grateful for it, and I just wanted to say that.
Yeah, well, thank you. It's nice when you have good care. And by the way, I didn't mean to disparage Vanderbilt. I'm not. I'm just saying it's busy. One reason, because it is an excellent facility, and Vanderbilt's certainly not alone. I've been in my share of emergency rooms, and they're all very crowded. But go ahead.
They are. So one of the things that that Al raised, and congratulations on being a new grandfather, is children who have disabilities. Over half the children in Tennessee who have disabilities are covered by TennCare, and the more severe the disability, the more likely they are to be covered by TennCare, which actually provides fairly unique and important life-saving care for many of them, especially those on a ventilator or who require nursing home care. And what people don't realize is that Medicaid also pays for a lot of the medically necessary special education services in the schools. So that includes things like speech therapy or occupational therapy. And so when we cut Medicaid, we are cutting the most vulnerable. We're cutting services for them, for those who have severe disabilities. And while my focus at the Commission on Children and Youth is children, one of the highest percentages of the Medicaid expenditures in Tennessee are for people who are in nursing homes. And those are either going to be elderly or disabled people, and that's...
and what happens when all of a sudden they no longer have Medicare paying the nursing home?
When Medicaid is no longer paying the nursing home, then their families are going to have to pay it. The nursing homes, there's not a federal law that says they have to keep those people. That are there.
So and if there isn't family or there isn't the means and Medicaid is cut, then these seniors will be shown the door.
Could have a devastating impact.
Yeah, I don't even like thinking about that. That's just... All right, let's go to Reverend Fuzz. Reverend Fuzz, good morning, sir.
Hey, Nate.
Hi.
I got a question for your guest. This is it. I heard the mayor say that health care is a basic human right. I was shocked. I said, wow, how nice. I want to ask your guest, these experts, what do they think about that statement? Is health care a basic human right? Thank you.
Thank you, Reverend. All right.
So in many countries, in most of the developed world, it is. There are many people in the United States who feel like it is. There are many who don't. And that's part of why we have not been able to get to anything like national health insurance or universal coverage or any of those things. But certainly, as we've talked about this morning, health care is pretty essential for children to be successful in school, to be productive in life. It's important for the workforce. If people are ill and can't get care, then they're either not going to be at work, or they're going to be spreading germs at work, or they're not going to be as productive when they're at work.
Linda makes a great point about the reason that health care is so vital, and it should be considered a basic human right because everyone needs it. There's no one living who doesn't need health care. Even if you consider yourself to be healthy, at some point you may get sick, you may be injured in an accident. So we're all going to have to access the healthcare system at some point in our lives. Even when you're born at a hospital, most people are, and there's no way to avoid the healthcare system as a person alive on this earth. So because it's something that everyone needs and everyone benefits from, it should be treated as a basic human right.
And the trick on that is, because it also, I think you can look at it and some might say it's a human necessity, and some might say it's a benefit. The problem, whereas I think we'd all agree, freedoms in this country, it's a basic human right for all Americans, but you have to pay for it. That's the rub here, okay? Everyone would I don't know anyone that would say I wouldn't want everyone to get the best care they can get, but you have to pay for it. And in America, you know as well as I do, if you have money, you can get the best medical care you can buy. If you can't pay for it, you're not going to get it.
Right.
And there's some, you have to be able to pay for it. That's the rub, okay? I mean, it's very nice to say basic human right, fine, but how are you going to pay for it?
Well, what the Affordable Care Act attempted to do was to make health care more affordable for everyone by encouraging everyone to buy insurance. That was the purpose of the individual mandate. That was the purpose of the employer mandate. When you have more people paying into the system, it spreads the cost around a larger group
because you have
of
a bunch of healthy people that are paying in and maybe don't need as much, and then that can cover the very sick.
Exactly. So what people fail to realize is that there's already cost shifting in our healthcare system. The people who have the ability to pay are paying more to cover people who can't pay. On average, a family pays $1,000 more for health insurance than they otherwise would because of uncompensated care. So if you have more people paying into the system, the uncompensated care goes down and people pay less across the board.
Right. That basic economics there.
So one of the ways that's been used to describe the people who are uninsured is they're like missing pillars supporting the healthcare system, and it's crumbling because of the missing pillars that really can't support the services we all need, and as Kinika said, we're all paying for it one way or another.
All right, let's go next to Granger. Hi, Granger.
Hi. Listen, I'd like to bring up the idea of suicide and the impact of this. But what we've heard about it on this on suicide in Tennessee, we have done remarkably well. We're one of the leading states about reducing suicide. Over the last 10 years, nationally, the suicide rate's gone up 24% because of the work of the Tennessee Suicide Prevention Network, and Ms. O'Neill can speak about that. Our rate here in Tennessee is too high, but it's only gone up 12%, half of the national rate. When you lose health care, when you lose the parity for mental health, when you lose substance use treatment, when you can't be treated if you have this opioids, all of this is going to lead to an increase of suicide, and I hate for our great work we've done in Tennessee to be lost due to this, and I'll listen to your answer.
Thank you for your. At first I wasn't sure where Granger was going, but now I've got a handle on that. Go ahead.
The Tennessee Suicide Prevention Network has done a great job in Tennessee helping people understand the signs of suicide and to prevent suicide whenever possible. We do a better job than most states in suicide prevention training in the schools and in a variety of circumstances. But as he said, it is a problem that has gone up nationally, and some in Tennessee, but at half that rate. And certainly when people don't have access to prenatal care, when they have substance abuse challenges and they need treatment, suicide rates are more likely to increase. And those are preventable deaths, and access to health care is a major part of that prevention.
And this Senate bill doesn't help matters by allowing states to waive essential health benefits, because one of those essential health benefits is mental health and substance use disorder treatment. So if that's on the chopping block and states are allowed to waive the requirement that insurers include those benefits, then fewer people are going to be able to access the care that they need if they're having mental health issues.
All right, let's go next to Ross. Ross, good morning.
Hey, is that you, Nick?
Yeah, hi Ross. Go ahead, sir.
It's Ross Marino. How you been? I haven't talked to you for a while.
Good to talk to you.
Hey, as far as this basic human right goes, let's carry this to its logical conclusion. Hey, it's a basic human right to have health care provided. Why, by golly, it's a basic human right to have a home. And then it's a basic human right to have a car. And not just a car, it's a basic human right to have a motorcycle. And it's a basic human right to have a couple large pizzas and a six-pack of beer. Now, you think I'm kidding, Nick? No. Look at anything the government has done along those lines, and there's no stopping. It will continue. This nation did not become the most powerful and the richest and the most desirable nation on the planet in record time because of our government intervention, but because our founding fathers created a limited government mandating that the people had maximum freedom.
Yeah, and I hear you talking on some of that, Ross, but in the big picture then, how do you relate that to the healthcare issue? I mean, where do you stand on this and what you see happening? Are you supportive of it, or what would you like to see done?
Okay, sorry it gets so windy, Nick. Thanks for reining me in. It's not about repeal and replace, as far as I see. It's about repeal and repeal. Repeal Obamacare and repeal the federal mandates that require physicians to have liability insurance. The biggest cost of any health care coverage is the fact that these guys can be sued and have everything taken away. So look at how much they are paying for liability insurance.
Remove those barriers, remove all the federal barriers preventing pharmaceutical companies to provide pills, remove every government, everything the government mandates, get it out of the way. And think about it. If a physician wanted to provide health care and he didn't want to pay for insurance, then you could choose to either go to him or go to somebody that wants to provide insurance or carry insurance. It's up to the people. Leave it up to the people.
Well, he's all for deregulation, but in terms of the malpractice, that tort reform has gutted it, just so you know. And Clint Kelly's one of the best malpractice attorneys in the entire state, and he's been on this show several times. That's just not happening anymore, Ross. All right, the big verdicts, unless someone really, really messes up. Tort reform protects hospitals and doctors, and I'm sure their premiums still for malpractice are up a ways because the insurance should be coming down with all the tort reform. I mean, it's harder to sue a doctor in a hospital, in Tennessee especially, than ever in the history of this state. All right, so that's the fact. Let's go to Candy. Hi, Candy.
Good morning, Nick, and to your guest.
Good morning.
I just wanted to ask the question when it was said that it's going to hurt the elderly. What does that mean? You know, this insurance, if they repeal or whatever. I just want to know what did they mean by that.
Yeah, what type of insurance? Are you on Medicare right now?
No, Medicaid.
You're on Medicaid. Okay, you're on Medicaid. So, and you want to know how this might hurt the elderly who are on Medicaid. And
yeah, like for instance, if they have to go to the emergency or ongoing treatment, and I just want to know what would happen during that time.
Okay, real quick, because we'll go to a break, and just a thumbnail, and keep in mind, we don't yet know exactly what's going to pass or if it will pass, but based on what we know about the plan, for someone like Candy, what should she be concerned about?
Well, one of the things that people should realize is that healthcare experts, including the AARP, the American Hospital Association, the American Medical Association, have all come out against this bill because of the cuts that it's making to Medicaid. When you have fewer dollars, it's going to impact everyone in terms of who gets services, how many people can access the system, and the pressure that you're putting on the few providers that remain accepting Medicaid. You're going to have longer wait times to get an appointment.
Longer
All
wait
of
times.
Those things
if
are
she
impacted.
can get an appointment, longer wait times.
They have reduced services that are covered.
Maybe not as many services that she's used to having covered, they could go away.
Exactly.
Okay, so she should be concerned.
She should be very concerned. And in terms of the elderly, Medicaid actually helps pay for some of the premiums they have to pay under Medicare. So they're referred to as dual eligibles because their health coverage is paid for by a combination of Medicare and Medicaid.
All right, we'll take a break. When we come back, more of your phone calls in our final segment as we talk about health care. Your thoughts or questions right after this.